Dr. Wan Xian from the Asian Heart and Vascular Center. I'm a heart failure intensivist with an interest in echocardiography and heart diseases in women.
Hi, I'm Dr. Goh Ping Ping, cardiologist at Asian Heart and Vascular Center. My subspecialty is in echocardiography, which is ultrasound imaging of the heart. I'm a strong advocate of preventive cardiology and women's wellness, and the official spokesperson of the Singapore Heart Foundation Go Red for Women campaign.
Cardiovascular disease is the top killer of women in the world. In Singapore, 1 in 3 women die of cardiovascular disease every year. Yet, many women are still unaware that they are as vulnerable as men to cardiovascular diseases. Women have specific risk factors of heart disease, in addition to the conventional ones that we know. They tend to have accompanying symptoms when presenting with heart disease, and this may lead to less timely and appropriate care. The traditional risk factors of heart disease include high blood pressure, diabetes, high cholesterol, being overweight, and unhealthy habits such as smoking, lack of exercise, and unhealthy eating habits. On top of these, there are risk factors associated with developing heart disease specific to or are more common in women. These include medical conditions during pregnancy such as gestational diabetes, hypertension disorders during pregnancy, preterm delivery, and a background of breast cancer treatment including receiving chemotherapy and radiation therapy. Women who have autoimmune disease and depression also have an increased risk. These conditions and the associated treatments increase the risk of heart disease in women but are often overlooked. Menopause is a natural physiological process usually occurring between 45 and 55 years old. During menopause, estrogen production drops significantly, and this leads to metabolic changes in cholesterol and sugar levels in the bloodstream. These increase the risk of developing high cholesterol, diabetes, and high blood pressure, and results in hardening of blood vessels through the process of atherosclerosis, increasing the risk of women developing heart and blood vessel diseases, including heart attacks after menopause. That's why women should not wait until after menopause to worry about their heart health. We should adopt healthy lifestyle habits, early health screening, and early detection of heart-related risk factors, which are important to prevent heart diseases effectively. Chemotherapy medications and radiation therapy used to treat breast cancer can also increase the risk of heart problems. Heart-related side effects of cancer treatments can include cardiomyopathy, which is weakening of the heart muscles, abnormal heart rhythms, heart attack, high blood pressure, and risk of blood clots. If there are pre-existing heart conditions or if the cancer treatments are associated with risk of heart conditions, it is important to have evaluation before starting treatment and also periodic monitoring of the heart during and after treatment. Cancer and heart specialists work together closely to reduce the risks of heart conditions related to cancer treatments. Significant physiological changes occur in the circulatory system during pregnancy. The amount of blood the heart pumps and the blood volume in the circulatory system increases by up to 30 and 50% to meet the metabolic demands of fetus growth and development. This stresses the heart and circulatory system. That's why pregnancy is likened to nature's stress test on the heart. With increasing incidence of risk factors such as hypertension, diabetes, high cholesterol, and overweight issues pre-existing in women, heart conditions are now more commonly uncovered during pregnancy. This may also be in part related to more women going through pregnancy at a later age. In fact, cardiovascular disease is now the leading cause of death in women during pregnancy and after delivery. High blood pressure disorders are the most common medical condition during pregnancy. Gestational hypertension refers to high blood pressure that develops after 20 weeks of pregnancy and usually resolves by 6 weeks after delivery. Gestational hypertension can cause complications such as preeclampsia in 50% of the cases. Preeclampsia occurs when kidneys are affected and proteins start appearing in the urine. Liver impairment and even fluid congestion in the lungs as a result of heart failure can also occur. This condition affects fetal growth and development and increases the risk of preterm delivery. Women who develop gestational hypertension or preeclampsia are at increased risk of developing hypertension, stroke, and coronary artery disease later on in their life. As such, women with pre-existing heart diseases or cardiovascular risk should consult their obstetrician or cardiologist for pre-pregnancy assessment and evaluation. This would allow maternal health status to be optimized before pregnancy. Risk of events during pregnancy can also be identified and managed to improve overall pregnancy outcome.
Heart disease is often considered to be predominantly a man's disease, but it is just as common in women. This is because symptoms occurring in women could be different or atypical, and they are often dismissed. While the most common heart attack symptom is chest pain or chest discomfort for both sexes, women are more likely to have atypical symptoms such as shortness of breath, nausea or vomiting, and back or jaw pain. Be aware of the symptoms of a heart attack. It is important to recognize them early and proceed to the nearest accident and emergency department should you suspect a heart attack. The earlier the treatment, the higher the chance of survival with less complications. Earlier, we explained that the risk factors are either modifiable, meaning you can take measures to change them, or non-modifiable, which means that they cannot be changed. The good news is you can reduce modifiable risk factors by introducing some changes to your lifestyle management and diet. It is never too late to start improving your heart health. These modifiable cardiovascular risk factors include high blood cholesterol, high blood pressure, diabetes, physical inactivity, obesity, smoking, and lastly, stress. Keep your cholesterol and blood pressure in check. Both men and women are at a high risk of heart disease due to high cholesterol arising from unhealthy lifestyle habits. But there is a key difference related to hormones that women should be aware of. Women generally have higher levels of HDL or good cholesterol than men due to the female sex hormone estrogen. When women undergo menopause around 50 years old and estrogen level starts to fall, cholesterol may begin to build up on artery walls. A buildup of plaque in vessels can increase the risk of heart disease or stroke. According to the National Population Health Survey 2019, 14.5% of women aged 18 to 74 in Singapore are reported to have hypertension, with the prevalence increasing with age. Go for regular health screenings and keep track of your blood pressure at home by using a blood pressure monitor. Avoid smoking. If quitting smoking is a challenge for you, let your doctor know. There are proven and effective methods to kick the habit. Also, try to avoid secondhand smoke. Exercise. The advice is to engage in at least 150 minutes per week of accumulated moderate intensity exercise. This includes brisk walking at 4 to 6 kilometers per hour, biking at 8 to 15 kilometers per hour, ballroom dancing, active yoga, or recreational swimming. Alternatively, 75 minutes of vigorous to intensive aerobic physical activity a week. Such workouts include jogging or running, biking, single tennis, or swimming laps. The exercise routine could also come in a combination of moderate and vigorous physical activity. Keep a healthy diet, including whole grains, a variety of fruits and vegetables, low-fat products, and lean meats in your diet. Avoid added and hidden sugars and too much salt. Keep a healthy weight. Obesity puts you at greater risk of high cholesterol, high blood pressure, and insulin resistance, the factors that increase the risk of cardiovascular disease. Maintaining a body mass index of below 25 kg per meter square and waist circumference below 80 centimeters can reduce your risk of heart disease. Manage stress. Constant stress can increase the risk of developing heart diseases by increasing the risk of high blood pressure and metabolic disorders. It is important to keep stress away by learning and adopting relaxation techniques.